Can I ask you something? Have you ever walked out of a doctor's appointment more confused than you walked in? Perhaps you've been struggling for months, maybe even years. You've stopped sleeping properly. You've developed anxiety you've never experienced before. Your confidence has disappeared. You don't feel like yourself anymore, and your body's aching. You're exhausted. You're forgetting your words. You're lying awake till 3 o'clock in the morning, and you think, what's happening to me? So eventually you make that appointment. You sit in the waiting room. You finally have gathered that courage to explain everything that you've been experiencing. And then the answer you receive seems to depend entirely on what happens to be sitting on the other side of that desk. One doctor suggests antidepressant, another says it's stress, someone else tells you you're simply getting older. Your friends tell you avoid HRT. Your sister says it changed her life. The newspaper says one thing, social media says another, and somewhere in the middle of all those voices is you, trying to decide who to believe. If any of that feels familiar, I want you to know something before we go any further. This video isn't here to persuade you to take HRT, and it certainly isn't here to persuade you not to, because that's not my role. My role is to help you understand the evidence, to separate headlines from science, fear from facts, opinions from research, so that by the end of this video, you feel better equipped to have an informed conversation with your healthcare professional about what's right for you, because every woman is different, every medical history is different, and every set of symptoms is different, and every decision deserves to be made with good information rather than fear. One of the reasons I wanted to make this video is because over the years I've sat with countless women in my counselling room, women who believed they were losing themselves, women who questioned their sanity, and who apologised for becoming someone they didn't recognise. Some of those women later discovered that they were in perimenopause. Others were already postmenopausal. Some chose HRT, some didn't, some couldn't. And what united them wasn't the treatment they chose. It was something much deeper. Almost every one of them said a version of the same sentence. I just wish somebody had explained this sooner. That sentence stayed with me because information changes lives, not because it removes every symptom, but because understanding replaces unnecessary fear, and fear is exhausting. There's another reason this conversation matters. When most people hear the word menopause, they imagine one moment, one day, one event when the period stops. But menopause is really experienced as one single day. It's a transition, one that often begins years before your final period and continues afterwards. In fact, many women searching for answers online are actually experiencing perimenopause, even if they call it menopause, and that's completely understandable. The terminology can be confusing. So throughout this series, when I use the word menopause, I'm often talking about the whole menopause transition, the years leading up to the final period, the point at which periods have stopped for 12 months, and the years that follow, because ultimately the label matters far less than making sure that women get the support and the understanding that they deserve. Today, we're going to take a journey together. We'll explore what HRT is, why it became so controversial, what the science is behind it, the benefits, the potential risks, and who it may help, and who may be suitable for, and perhaps more importantly, why no woman should ever feel frightened about making such an important decision. This isn't about choosing sides, it's about understanding. So, make yourself a cup of tea, get comfortable, and let's look at the evidence. The hormone that quietly influences almost every part of you. Can I ask you another question? When I say the word estrogen, what comes into your mind? For many women, the answer is simple. It's a female hormone. And whilst that is only a tiny part of the story, because estrogen isn't just involved in fertility, it isn't only about periods. And it certainly isn't only important if you're planning a family. In fact, estrogen quietly influences almost every system in a woman's body. It's one of the reasons why the menopause transition can feel so confusing. You might go to your GP, you may say you're anxious, your joints ache because you can't sleep, or because you've suddenly developed palpitations, because your skin feels differently, or you've lost confidence. None of those symptoms seem connected, but sometimes they are connected by one common thread: changing hormone levels, and particularly changing levels of estrogen. I often explain it like this: imagine your body is an orchestra. Every section has a different role: your heart, your brain, your bones, your muscles, bladder, your skin, your reproductive system. Each one plays its own instrument. And for many years, estrogen has quietly been helping to keep the orchestra playing in harmony. Not perfectly, but consistently. Then during perimenopause, the conductor begins to leave the room and return and leave again. Some days the music sounds almost normal, and other days everything feels slightly out of tune. And that's why one week might feel absolutely fine, and the next week you can barely recognize yourself. It's not because you're weak or because you're imagining things, it's because perimenopause isn't usually a steady decline. It's a period of fluctuation. Hormone levels can rise and then they can fall, which means your symptoms can fluctuate too. One day you sleep well, the next you wake at 3 o'clock in the morning, drenched in sweat. One day you feel calm, the next you feel overwhelmed by anxiety and you can't explain it. That unpredictability is one of the reasons so many women begin to question themselves. But once we understand what's happening biologically, something very important begins to happen psychologically. We stop asking what's wrong with us and we begin asking, could my body be asking for support? So imagine you've worn glasses every day for years. You don't notice them and they're simply part of your life. They help you to see clearly, and one morning someone quietly removes one of the lenses. At first you probably wouldn't even notice. Your brain would compensate. You'd maybe squint a little, move closer to the TV, perhaps blame your tiredness, and then a few weeks later they remove the second lens. Now life feels much harder, not because you've suddenly become incapable, but because something your body has relied upon has now changed. In many ways, this is a little like hormones. For decades, your body has been producing hormones naturally, not just estrogen, but progesterone and testosterone too. These hormones have been quietly communicating with your organs, tissues throughout your body, almost like thousands of tiny little text messages sent every day, keeping the bones healthy, regulating your body temperature, supporting your bladder, looking after the vaginal tissues, work alongside the brain to help regulate sleep, mood, and cognition, support the cardiovascular system. The remarkable thing is, most of us never think about these messages until they begin to change. And that's exactly what happens during perimenopause. As ovarian hormone production becomes less predictable, hormone levels fluctuate. Some months the ovaries produce more hormones, other months much less. Eventually, after menopause, estrogen levels remain much lower than they were during the reproductive years. Some women, those changing levels cause relatively few symptoms. For others, the impact can be profound. And that's where hormone replacement therapy, or HRT, enters the conversation. Despite its name, HRT isn't about replacing a 25-year-old's hormone levels. It's about restoring enough hormone activity to help relieve symptoms and, for many women, protect aspects of long-term health when it's appropriate to do so. And that's an important distinction. We're not trying to turn the clock backwards. We're trying to support a body through a natural transition. Now, HRT isn't one single medicine. It's an umbrella term for several different treatments. Some women only need estrogen. Others need estrogen combined with progesterone to protect the lining of the womb if they still have one. Some women may also be offered testosterone if they have persistent symptoms such as a low sexual desire after a full assessment and other causes have been considered. This is an area where specialist guidance is important because testosterone isn't appropriate for everyone, and HRT can be delivered in different ways: through a skin patch, a gel, a spray, a tablet, or local vaginal treatments such as creams, tablets, pessaries, which are designed to treat symptoms like vaginal dryness or discomfort. We'll explore each of those in much more detail shortly, but before we do, I want to pause here because I think there's one question that has been hanging over us more than 20 years, and it's a question that still causes fear today. If HRT can help women, why are so many women frightened of it? To answer that, we need to travel back in time, back to one research study, one set of newspaper headlines and one moment that changed women's health forever. So the study that changed everything. Can I ask you another question? Have you ever wondered why hormone replacement therapy still causes so much debate? Why one woman tells you, "It gave me my life back," while another says, "I'd never touch it"? Some doctors are very comfortable prescribing it, and while others remain cautious. To answer that, we need to travel back to the early 2000s, because the story didn't begin on social media. It began one of the largest research studies ever carried out in women's health, a study called the Women's Health Initiative. Now, before we go any further, I want to say something really important. Research matters. Without research, medicine cannot move forward. Every treatment we use today exists because people were willing to ask questions and study the answers. The Women's Health Initiative was an ambitious study designed to understand how hormone therapy affected the long-term health of post-menopausal women. It looked at important outcomes such as heart disease, fractures, breast cancer, and stroke. Those are exactly the kind of questions researchers should ask. But in 2002, one part of the study was stopped earlier than planned. Why? Because researchers identified an increased overall balance of certain risks compared with benefits in particular groups of women receiving one specific combination of hormones used in that arm of the study. When the results were announced, the headlines spread across the world. Many women understandably became frightened and stopped taking HRT immediately. Some threw the tablets in the bin, and others never considered HRT at all because the fear stayed with them. Doctors changed their prescribing practices. Confidence in HRT fell dramatically, and for many women, that fear never completely disappeared. But here's where this story becomes more complicated, because science really stands still. As more researchers examined the Women's Health Initiative data over the following years, they began asking further questions. Were all women in the study the same? Did age matter? Did the timing of starting HRT matter? Did different types of hormones carry very different risks? Could the results from one preparation be applied to every form of HRT? The answer was no. As the evidence evolved, researchers recognised that the picture was much more nuanced than earlier headlines had suggested. For example, many women in that study were older than the age at which HRT is now commonly started for menopausal symptoms. The average age was around 63, and many participants were years beyond menopause. We also now recognise that the different hormone formulations and routes of administration may have different benefit risk profiles. Over the past 2 decades, organisations around the world have reviewed not only the Women's Health Initiative, but also many other high-quality studies. Today, most menopause specialists no longer ask, is HRT good or bad? Instead, they ask a much bigger question: is HRT appropriate for this individual woman at the stage of her life with her particular medical history? That is personalised medicine, and I think this is one of the most important messages in this entire video, because medicine is really black and white. It's about balancing benefits and risks for the individual sitting in front of you. Many of us would almost rather have a definite answer, even if it's not the right one, than live in uncertainty, but healthcare doesn't always work like that. Sometimes the most honest answer is, let's look at your circumstances together. And in my opinion, that's exactly the conversation every woman deserves to have. Not a rushed appointment, not a frightened headline, not advice based on someone else's experience, but an informed, balanced decision about her own health, because ultimately that's what good healthcare should always be. Not fear, not persuasion, understanding. So now that we've understood the history, the next question becomes obvious. What does the best evidence actually tell us today about the benefits of HRT? Let's look at that next. How HRT may help different parts of the body. This is the bit where I'm going to draw a house. I know it seems very simple, but sometimes the simplest pictures help us to understand the biggest ideas. Earlier, I said that menopause doesn't just affect one part of the body. It affects many different rooms in the house. So today, I'd like to walk you through the house. Not to persuade you to take HRT, but to help you understand why it may help some women and why others may decide that a different approach is right for them. Because the first step to making a good decision is understanding what we're actually talking about. So I'm going to draw a sun to represent the thermostat. So room number 1. So let's begin with one of the symptoms that most people associate with menopause. Hot flushes, night sweats. Many women tell me it's like somebody suddenly turned the heating on inside your body. Or I can be sitting perfectly comfortable and then within a second I feel like I'm burning from the inside out. If you've never experienced one, it's difficult to imagine. If you have, you know they're far more than simply feeling just warm. You may wake up soaked in sweat, you need to change your clothes, you throw your duvet off and then you have to pull it back a few minutes later, and it's exhausting. So why does it happen? One of the key reasons relates to a tiny part in the brain called the hypothalamus. I often think of it as your body's thermostat. Throughout your life, estrogen has quietly helped support many of the systems that regulate your body temperature. As hormone levels fluctuate during perimenopause, that thermostat can become more sensitive. Tiny changes in the body's temperature that would have once gone unnoticed can suddenly trigger a hot flush. It's not that you're imagining it, it's biology. And this is one area where the evidence is very strong. For women who are suitable candidates, HRT is considered the most effective treatment for reducing vasomotor symptoms, including hot flushes and night sweats. That doesn't mean every woman needs it or wants it, but understanding why these symptoms happen can be incredibly reassuring. Let's use red this time. So we'll go into the bedroom, so room 2. So let's draw a little bed, because for many women this is a real struggle. Sleep, or perhaps the lack of it. Sometimes women say to me, Susie, I can cope with almost anything if I could get just a good night's sleep. Poor sleep doesn't simply make us tired, it changes the way that we think, the way that we feel, and the way that we respond to other people. When you've been awake at 3 o'clock 4 nights in a row, your emotional resilience naturally begins to wear thin. Sometimes it's the night sweats waking you, sometimes it's anxiety. It's simply that changing hormones affects the systems involved in sleep. Often it's a combination of several things. If HRT successfully reduces troublesome night sweats and stabilizes some menopausal symptoms, many women find that sleep improves too. And when sleep improves, life often feels more manageable. Not because every problem disappears, but because you're no longer trying to solve those problems through exhaustion. So, room 3. Excuse my drawing. So that's supposed to be a brain. This room is perhaps one I hear about most often in my counselling room. Women say things like, I can't remember the words anymore. I'll walk into the kitchen and I forget why I was there. I've always been organised and now I feel overwhelmed. I don't recognise myself, and perhaps the most heartbreaking sentence of all, I think I'm losing my mind. If that's something you've experienced, I want you to hear me. Brain fog does not mean you've suddenly become less intelligent. It doesn't erase your life's experience, and it doesn't erase your skills, and it certainly doesn't erase who you are. Hormonal changes, poor sleep, stress, anxiety, and the normal demands of midlife can all contribute to the changes in concentration, in memory. Researchers are still learning about exactly how fluctuating hormones influence cognition, and not every question has been answered. Some women notice that when troublesome menopausal symptoms improve, they feel mentally sharper too. Others continue to experience brain fog for a little while longer. The important thing is, you deserve to be listened to, not dismissed, and if you're concerned about changes in your memory or thinking, it's always important to discuss these with your healthcare professional, because not everything is caused by menopause. Room 4, and this is what I call the silent room. This room really gets our attention because nothing hurts, nothing shouts, nothing tells us that change is happening. Our bones are quietly renewing themselves all the time. Throughout much of our adult life, estrogen plays an important role in maintaining that balance. After menopause, bone density tends to decline more quickly. That doesn't mean every woman will develop osteoporosis, far from it, but it does mean that bone health deserves our attention. This is why discussions about menopause should include more than symptom relief. Weight-bearing exercise, balanced diets, adequate calcium, vitamin D where appropriate, and not smoking, moderate alcohol intake, and all of these contribute healthier bones. For some women, HRT also plays an important role in helping them to maintain bone density, reduce fracture risk, and when it's being used again, it's about understanding the whole picture. So room 5, the room red for a heart, the heart. Many women are surprised to discover that menopause isn't only about reproductive health. Our cardiovascular system changes as we age too. Researchers now understand that timing appears to matter. For women who begin HRT around the time of menopause and who are suitable candidates, the balance of benefits and risks may be different from women who begin treatment later on in life. This is sometimes called the timing hypothesis, but this isn't something to work out alone. Your age, your medical history, your blood pressure, family history, whether you smoke, the type of HRT being considered, all of these factors matter, which is why an individual conversation with a healthcare professional is so important. It's a flower. This is the room that nobody talks about, and the door's firmly shut. Many women experience vaginal dryness, discomfort during intimacy, bladder irritation, urinary urgency, and recurrent urinary tract infection. Yet so many women suffer in silence because they feel embarrassed to mention it. Because please know this, these symptoms are common. They are real and help is available. Sometimes local vaginal estrogen can make a significant difference for women experiencing these symptoms, and because it acts mainly where it's applied, it has a different role from systemic HRT. Your healthcare professional can advise on whether it's appropriate for you. So, what have we discovered as we've walked through the little house together? We've discovered I can't draw, but we discovered that menopause isn't simply about hot flushes. It's about the whole body adapting to a new chapter of life. And we've also discovered that HRT isn't about chasing youth, and it's about helping some women feel more comfortable, more confident, and more like themselves during that transition, when it's appropriate for them. But every treatment has two sides. Every decision deserves balance. And before anyone decides whether HRT is right for them, there's one more conversation we need to have. We need to talk honestly about the risks, because understanding isn't built by looking only at the positives. It's built by seeing the whole picture. So a gentle truth, sometimes the greatest gift we can give ourselves isn't finding the perfect treatment, it's finally understanding why we've been feeling the way we have. Because once understanding replaces self-blame, healing often begins. Thank you so much for staying tuned for part 1 of the truth about HRT, and I will be back very soon with the next part. So please stay notified, like, subscribe and share, and I will see you very, very soon. Thank you. Thanks for watching.